The speed is something that we look at as a practitioner. So if the speed is too fast, that tells me that the heart is probably pumping a little too fast and it's probably under stress. When it's too slow, the heart or the circulation, it doesn't have the force to go on. Using the pulse is helping us to know what's going on inside. And that is the manifestation of the pulse. It's kind of like a message from the body and telling you like what's going on. When you go to a Chinese medicine practitioner, a lot of time, other than intake, like ask you question about past medical history, the present health concern, after that, usually you will get the practitioner put their hands on your wrist and to check the pulse. So the checking of the pulse or pulse diagnosis is part of the TCM diagnosis method, which include the tongue diagnosis, facial complexion diagnosis, abdominal diagnosis. We incorporate all these four, not just one, but pulse diagnosis, one of the four diagnostic tools, is very important. So in the past, pulse diagnosis is a long-standing diagnostic method that's been used for many generations of practitioners. And if you imagine yourself back in the days that there's no x-ray, there's no blood test, there's no sleep test, how do we tell that the patient is sick? By checking the pulse, we're not just looking at the beat, we're also looking at the shape, we're looking at the depth, we're looking at the force. A lot of time, if you can think about the pulse as a diagnostic tool, it reflects what's going on inside. So the nerve activity can affect the pulse. The heart, how hard is pumping can affect the pulse. The hormone can affect the pulse. Or even what you eat or the blood circulation can affect the pulse. When you're checking the pulse, we're looking at, is it deep or is it shallow? Is it tight or is it forceful? Is it weak or is it strong? Or is it rolling like the shape of pearl, which we call it slippery? Or is it really fast, but there's no root? Sometimes when we check the pulse, first we need to check, is there any root? Meaning that when we press down, that there's still some force when it's at the deep portion, and then gradually we'll look at, is it really floating, like something is conjugated or stagnant on the surface of the body. And usually that's when a patient is like sick, have some acute sickness, acute inflammation. And when it's deep and then weak and then forceless, a lot of time that patient might have some constitutional issue, like some developmental issue, or the illness is more chronic, that the body doesn't have the force or the energy to recover. Also, the speed is something that we look at as a practitioner. So if the speed is too fast, that tells me that the heart is probably pumping a little too fast and it's probably under stress. When it's too slow, the heart or the circulation, it doesn't have the force to go on. Using the pulse is helping us to know what's going on inside. And that is the manifestation of the pulse. It's kind of like a message from the body and telling you like what's going on. If you like this video, please subscribe and follow me, and I'll see you soon.